Hello, moms and dads. This webinar is on torticollis and head shape. Your kiddo might be dealing with one or both of these. Either way, you'll find some valuable information on what you can do to help. So we're going to talk about three things in this webinar. Number one is what causes it. The two main things that we see in our office leading to torticollis and potentially misshapen head. Number two, why it's important to address, and then lastly, how to address it. And we'll talk about the difference between PT and chiropractic, how they're different, and then how they can be used together, as those are the two most common ways to help your kiddo out. So if your kiddo is a newborn, an infant, maybe even going into toddlerhood, I definitely want to be able to support you in this journey. I know it can be challenging if your new baby is struggling a little bit as they've been introduced into the world. So if you don't know me, my name is Dr. Ty. I own Whole Family Chiropractic, and we specialize in pediatrics, and we specialize in a neurological approach to chiropractic, so it's very safe and very gentle. And one of the things we love doing is helping kiddos get off to a good start in life. So torticollis, what that means is there's a muscle in the neck and it's stuck. And as a result, because it's stuck in spasm, your kiddo isn't able to turn his or her head the way they're supposed to. Typically, that muscle is called, this one here, it's called the Sternocleidomastoid. And often when it gets stuck, you'll see your kiddo in a stuck position. And you might notice that every time you put him in the car seat, their head is turned a certain way. Or when you put them down to sleep at night, they're always looking the same direction when they're sleeping. They favor that side. Even maybe you notice nursing might be easier on one side over the other. And what we want to do is help, because not only is this important to help them feel good in the short term, but there's other effects that we want to be able to support their body with long term. And I'll get to those in a moment here. So number one, as I said, what are the two main causes for torticollis that we see in newborns, and that can also tie in to head shape and how the bones of the head, the cranial bones, are developing. So the first cause can be due to positioning in the womb. For example, we had a set of twins that came in to see us shortly after they were born, and mom said, yeah, that third trimester, there wasn't much room, so the one baby on the bottom, she was basically in kind of a twisted turn position that whole third trimester. They didn't really move much after that. So in that case, her neck was in that strained position from an early stage in development, still in the womb, and when she came out, sure enough, she was tilted and turned in that very same position. The other thing that we'll see that I find is more common has to do with the labor and delivery process. Now, even in a perfectly normal labor and delivery, as baby's coming out, there's a lot of pressure on that baby's head and neck. I remember when my son was born, he had a pretty stressful labor and delivery, and as a result, the little plates on all the ridges on his head were overlapped instead of being relatively smooth. And we see a fair amount of newborns in our office. There's, a natural level of that shift, but he had a really excessive amount just based on his positioning as he was being born. And, as being a father for the first time, being so enthralled with the process of holding a newborn in my arms, and then also saying, all right, Ty, you got some work to do. We got to get your son back on track here as quick as possible. So if you are struggling, I can relate as a parent myself. So that birth process, as I said, there's a lot of pressure coming through. We had, as an example here too, of a more challenging birth, we had a woman who was trying to deliver vaginally. However, her baby's head was stuck in her pelvis. So each contraction, instead of pushing further and further through, each contraction was causing a lot of extra strain because baby wasn't progressing and he was stuck in the side. She actually had 42 hours of labor. She was trying so hard before had to end up with a C-section to get the baby out. So on a challenging labor and delivery, that adds up even more the likelihood that something's out of alignment in the neck, and that's going to affect the nerve supply between the brain and those neck muscles. So what before I go into like how that is affected and how we address it, I mentioned to the pieces of what happens if it doesn't get addressed. So sometimes your kiddo outgrows it. Other times, what we'll see is things start to become favored one side. There was a 6 month old. I'll share his story here in a moment, but he would turn his head to the right and not to the left because of the torticollis he had. He also had a lot of asymmetry in his head bones. But when he started rolling, then he came to see us at 6 months. This had started earlier, about 6 weeks, 2 months old. Mom said she started to notice this little bump on his neck. And as a result, because he was only looking one way, he only wanted to roll that way. And obviously, with our kiddos, we want them to develop symmetrically, not only for their muscles, but also because all the movements little babies are doing are helping to integrate pathways up into their brain. So we want to make sure that we're helping them get balanced early on. For example, when a baby first starts to push their head up and look side to side, their eyes are tracking in this back and forth manner. It helps them read as kiddos later on. They help to, as the body is moving, it helps to integrate certain reflexes that help your kiddo sit still in class and learn. So there's a lot of benefit aside from rolling and sitting and crawling and walking that help with normal movement, but also brain development as well. So let's go into then what does that look like from the standpoint if something's out, how is that causing that muscle to be in spasm, and what can you do about it? I'm going to jump in here too. This is zoom in. As I mentioned, there's this muscle here in the neck. It's called the sternocleidomastoid, and that's the most common one that we see with torticollis. Now, if we jump ahead here, what is controlling that muscle? Now, if we take one step back, we know all the muscles in our body are controlled by our brain and our nervous system. If I flex a muscle, the only way that muscle contracts is if my brain tells it to. A muscle doesn't go rogue and just start contracting on its own. It receives a message from the brain telling it what to do. So if we dive in here and zoom back in to this muscle right here is the one we were just talking about, the SCM, sternocleidomastoid. It's taken apart here, and we'll just go briefly. The main nerve that controls it is this accessory nerve. And that is this nerve right here that comes down to this muscle. And the reason I want to show you this is that this cutout, this part is the base of the skull, and then these are the cutout nerves of the top bones in the neck. And you can see there's a little bit of space that it leaves there. It's also receiving this input all the way up and in between these different bones. What that means is that there's a very narrow hole that comes out of the base of the skull that this nerve comes from, and then as well as those little nerve fibers along the neck. So if something's out of alignment in the neck, now that nerve flow starts to become restricted. And this in our office is one of the major things that we see that causes torticollis. And if that nerve is off, if it's being constricted, if it's telling that muscle to go into spasm, now baby gets stuck that way. And if baby gets stuck this way, you might start to notice that every time you put them on their back, there's always one part of their head that's touching the floor, the mat, the ground behind them. And maybe start to notice like, oh yeah, that part of the head is actually getting a little flatter than the other part. One of the things that helps shape the baby's head and skull is when they lie on their back and they turn side to side. That's why we want freedom of movement here as well, is turning side to side helps mold and shape the head bones. If baby's always stuck one way, that one side is getting all the pressure and can start to get flat. If it starts to get flat, it might even start to shift things up in the front. So what we want to look for are anything out of alignment here affecting that nerve flow. So if we go back to the 6-month-old, I'll grab another picture here for you to show you what that might look like. How can we tell if your kiddo might benefit from chiropractic? And as I'll share a little bit about what we do and then again contrast that to PT, how they are different and how they can be used together. So in our office, What we measure is using a nerve scan here that measures all the nerve channels along the spine. So if we were to zoom in, that neck area is from that picture that I just showed you previously. If something is off here, we use what's called a thermal scan to measure if those nerve channels are open or if there's stress on those nerve channels. So if we go back to that picture I was showing you, we say, okay, this muscle here, it gets its nerve supply from these nerves in the neck. Are those nerves working properly or are they stressed? And we do, on infants, we do what's called a thermal scan. So it measures temperature along the side of the spine, and if something's off, it lets us know. So we're looking both on how we're feeling the bones along the spine to see if they're aligned, and then we're measuring those nerve channels as well. Either one can cause that muscle to become compensated and stuck in spasm. So the nice thing with this scan, it's very safe, very gentle, whether it's a newborn baby or a pregnant mama. We can do it on any age, any circumstance, because nothing goes in the body, nothing comes out of the body. So this was that 6-month-old that I mentioned that came to see us, who was only turning his head to the right, and we see a lot of stress up top here. I know this might be a little small depending on how you're viewing it, but ultimately white is ideal. We got green, blue, red are mild, moderate, severe if there's any stress on those nerves. So clearly you can see we're in the red zone and there's a lot going on up top. So that scan is step one to see if this is something that we can help with. We do the scan and then feeling the spine. If we can help, we put a plan together to start the adjusting process. Now, the good news with this boy, as we started out here, we moved to this as the follow-up scan. So you can see this area up top is clearing through very, very nicely on his follow-up scan. That lets us know that we're making progress aside from what mom and dad were reporting. So the cool thing in this story was not only did they themselves start to notice Jack was turning his head and freeing things up, but he had been seeing PT previously and seeing a PT from about 2 months old till we saw him at 6 months old. And mom said, there was like little gains, but we felt stuck in the progress. We were told to do certain stretches, but it was tough to apply them. Because, at a few months old, your kiddo isn't always the most cooperative in doing his or her exercises. But also, it felt like maybe he'd feel stretched out for a little bit, but then just tighten back up. And so as we started adjusting him, not only did he start to free up his range of motion, but when mom brought him to PT, the PT said, wait a minute, he's starting to make these really quick gains, more than he had previously and more than I was expecting. And we get that report a lot with the kiddos that we see that do PT and chiropractic together. And the reason is if PT is focusing on stretching and strengthening the muscles, that can be beneficial. However, if the nerve channels are being blocked, like we saw in Jack's case, if there's stress up top here, those nerves are going to tell the muscle to tighten back up. And as a result, there's not going to be often as quick of gains that you'd be looking for as a parent. So what we often recommend is doing a combination of both. The chiropractic helps to free up those nerve channels and get the nerve flow going so the brain can start to tell that muscle to relax and free things up so the body can move freely. If there's something out of alignment that might prevent things from turning, that we help adjust and correct. Or if that nerve flow is being affected, telling that muscle to spasm, we help release that nerve flow. Now when things are moving more freely, that allows your kiddo to go back to PT and make better gains than they would have seen. And I'll show you one question parents often ask then is, like, how do we adjust? And make sure I have the sheet here. Is it safe for babies and newborns? So my own son, I adjusted at 2 minutes old. He was still on mama's chest in the birth tub, and I was able to adjust him at 2 minutes old very safely, just like the other newborns that we see in our office and the other kiddos that we see. So what we know with chiropractic is there's different levels that can be addressed. The most common is feeling the bones of the spine. If something's out of alignment, doing a more, like what's considered a manual adjustment, twist, turn, pop, crack, to move the bone back into place. And that's very safe as well. However, what we often see is that it's that much force isn't necessary. We know that the muscles tell the bones what to do. This is often in the realm of PT, might be working on that muscle level to strengthen, stretch the muscle. And we know that that can have a benefit. However, as a lot of parents report, things just seem to go back because the nerves tell the muscles what to do. So if the nerve is under stress, what that can lead to is a muscle that just goes right back into spasm. So in our office, we do a very gentle approach working on that nerve level, because we know if we free up the nerves, that allows the muscles to relax and then allows the bones to go back into place. The other side note that I'll say here is going beyond the torticollis piece, you might notice some other things in your kiddo, and I want to bring that up in case it's relevant for you. So this is a nerve chart that matches, as I said, with the scans that we do. So for example, in Jack's case, we had the C1 was in red. If we go to this nerve chart, we say, okay, C1, where do you go in the body? You go to these nerves here. If that nerve is under stress, what might pop up? The torticollis and the plagiocephaly is another word for misshapen head. We'll also see with some of these neck nerves, the stiff neck shows up in a few different categories up top here. The thing that I wanted to bring up is you might also notice your kiddo has more reflux. Maybe they're not sleeping well at night, or maybe their digestion is off, they're really constipated. And if those words are a little bit small, depending again on your screen, we've got reflux, difficulty sleeping, and digestive system, are all controlled by that same group of nerves. So if you see any of those other things with your kiddo, that's like an extra sign that they'd really benefit by getting checked by a chiropractor that's trained in pediatrics and trained in neurology. In Jack's case, the 6-month-old that I mentioned, when he came to see an office, he was also super constipated, especially the first 4 months of his life, because the nerves that were causing the torticollis were also affecting his digestion. So hopefully that is helpful in giving you an understanding of how to look at your kiddo. I know if you're seeing your kiddo struggling, it can be really tough because, we just want our best for our newborn babies. And it's definitely something we absolutely love helping with, something that we see great results with. So if you're interested in that, feel free to reach out, and we are happy to talk more if you have questions. And if you're interested in getting your kiddo checked and seeing what those scans show, we are always here to help you.